Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Best wishes from the Netherlands. I really love the program. It's really helping me out. I'm on now since October. I have a bit of a puzzle going on because of my eyes and the neck. I'm halfway the neck videos now. The thing is, I made a fall during an expedition in September 2023, and I fell forward on the ice. We crossed the ice cap in Greenland. It was on the last day. A few hours later, we finished, and I only had a sore shoulder. And weeks later, they found out that I had a concussion. What I forgot about is that before I fell forward, I also fell backwards because the sleigh was hitting my knees, and then my head all the way got how do you say, backwards to my back, and I fell on the sleigh. So I only said ow, and we continued. A half hour later, I fell forward again with the sleigh, and that's when I fell on the right side of my head. I didn't have any headaches. It's just that because of I saw some light flashes of light that a physiotherapist was alarming, and then we found out that there was concussion. The thing is that they put me back to work too soon, and I didn't recover from the concussion, and it ended up in March I was brought to the hospital because I got very dizzy at work and collapsed, and I couldn't move my arms, my legs, and I couldn't even lift my head. So they put me in the hospital for a week, and then sent me home and said you will be fine in 2 weeks' time because it's just an infection. Well, I didn't have much progress till I started this program, and now I'm a bit puzzling with the eye section and the dizziness section and the neck section. I do wear prism glasses because I've had a frontal core lesion in 2009. I had a whiplash then. The prism is tested twice now, in April and November, and it's not stable anymore. So the guy says, I'm not giving you new glasses because first it has to be stable before we do that. The first question is, do I do the eye exercises with or without the glasses? And the next question is, in the next session, Dr. Kem says something about sometimes you first work on the neck and then you do the eye exercises. So the question is, should I start with the neck and then do the eye exercises, or do I continue with the eye exercises? I have done some of them somewhere in June with a physiotherapist, and then we had to stop them because it made me really, really tired, and I couldn't even walk for 100 meters. So I'm doing them. I started them again a couple of weeks ago, and I'm working with the eye stuff, but now I'm on the next session, and I'm wondering what should I do first. So that's the two questions.
So the reason, are you getting neck treatment right now at all or no?
Not anymore, because when we tried that, the physiotherapist, I have now tried it, and then I got really dizzy for 2 weeks. So he is a bit careful now.
That's a perfect reason to do more. That's where people go wrong, right? Because it's like, if you're getting neck treatment and that's making your symptoms worse, it means that your neck is probably involved, and avoiding treatment isn't going to make it any better. It's still there, right? So you have to kind of work through. Sometimes you have to get a little bit worse before you start getting better. So I wouldn't avoid it. I would actually push into it. That's one you want to kind of push into. Now, the issue with the eyes is that the eye motion and how your eyes function is extremely related to your neck. So the reason I suggest you generally for most people do neck stuff first is because if you're doing eye exercises, every time you move your eyes, it engages your neck. And if you have neck dysfunction, eye exercises are going to just make your neck tighter and tighter, and you're going to hit a roadblock where things aren't working, right? Your prisms are unstable, probably because it's not the eyes, it's your neck.
Mm.
And so that's why you're getting all this variation, because day one, your neck might be looser than day two. And so the things are going to look different on your exam. So that's why if you fix the neck first, in most cases, the eye problems will resolve. And if they don't, now you can do eye exercises that are for the remaining actual visual problems. Whereas if you have neck dysfunction, you're doing eye exercises, that's generally just gonna flare your neck up, and you're gonna have increased symptoms with that, and it's gonna just be related more to the neck. So for most people, if you can do them simultaneously, that's great because they kind of work in tandem and build on each other. If you want to pick one, then I would always start with neck first, and then once the neck is good, then you can go and do the eye stuff.
Okay. Yeah, that's exactly what happened last week. That then my neck got stiffer and stiffer, and then that's why I was. And then I saw this video, and I thought, okay, I have to ask that question.
Yeah.
So we should continue with the neck. Yeah, the physiotherapist wasn't so sure when it happened, and I got so dizzy. He wasn't so sure to continue with the neck, but I'll speak with him about it, and we'll see what.
Yeah, like when I see a patient, for example, my my explanation before I do anything is just so you're aware, when I treat your neck, this may flare you up. Your headaches may be worse for a few days. Your dizziness may be worse for a few days, but that's a good sign because it just tells us that your neck is definitely involved in this situation. Now, in, about half of my patients, also you feel really, really good after. Your headaches are gone and your dizziness is gone. Like I'm treating somebody right now and they're having lingering dizziness issues from like a viral infection. So it's not concussion, but it's a viral infection. But when you're dizzy, your neck tightens up. So now when your neck tightens up, it causes kind of lingering dizziness. So the viral infection is gone, the vestibular function is fine, but now it's just the remaining dizziness from the neck. And I said, I might flare you up when I treat you. So just be aware of that. This is not really cause for concern. You may get dizzy, you may have headaches. And I treated her and she came back. She's like, I felt great all week. Like this was amazing. So some people you're going to feel really good right after. Some people are going to get flared up. So you may just be one of those people that gets flared up. And that's okay because every time you treat it, the flare ups are going to be less and less. And after a few treatments, they won't happen at all. And you're going to feel good after those treatments. But if you stop, you're basically just going back to square one and you have to start the whole process over again.
The other component too to think about is some people stop because they become really afraid of the symptom that shows up following a neck treatment. So if you get dizzy, right, dizziness can be a really frightening experience for a lot of people. So if you get dizzy afterwards and suddenly you're like, I don't want to do this again, right? Our sympathetic nervous system's now activated. We're feeling a lot more tightness in the body. We're getting anxious, worried, we're probably catastrophizing a little bit about what that could mean for your future. So all of these components are important to think about too. So what is the reason that you're not going back? Is it partially maybe anxiety or worry or fear about what could happen if you keep getting this symptom? If so, maybe work with your provider and say, hey, I'm actually really fearful of this symptom. Can we ease off a little bit and do things in smaller chunks so that I can build confidence that even if I flare up, I'm still moving forward, versus, having them go really deep in there and then you're flared up for 2 weeks and now you're spiraling with that anxiety component. So it's important to find this balance between the actual physical treatment itself and how you feel mentally about what's happening. So we've talked about this before in other lives about feeling safe with your provider. So having that communication with your provider, just the way Dr. Cam said with his current patient, he tells them, hey, when I do this, it might flare you up. What you've done there is build trust with your client that they know what might happen in their bodies following a treatment that you've done. So now there's this baseline of trust that, hey, this is going to be okay. I'm now prepared of what might happen to me. And having that communication, that open communication with your provider can help you build trust for your own experience on how you're going to feel afterwards and to bring down that fear response of the symptom that it might provoke. So I would invite you to really openly communicate with your provider what's happening and how you're feeling about the symptom, and see if he or she can work with you regarding the intensity of the treatments, so that you can work together to build up that strength, right? So to recap, having symptom flares isn't dangerous. It's probably helpful because you're working in the right areas and your body's realigning. I don't know if that's the right words. Dr. Cam might correct me. But number two is this sense of allowing yourself to build safety in the body, safety with your provider. Having that proper connection is going to help support you to not feel anxious and overwhelmed, and it will help keep your nervous system regulated for a treatment that you hope to be beneficial. So if our nervous system is regulated, we're probably going to feel a whole lot better about receiving a treatment that might flare up our symptoms.
Yeah, thanks for that, because that's exactly what happened in September. And after that, I started this program. So I know better now what happened at that point. The point is more that he is getting insecure working about with my neck, so he's doing other stuff now first. And then maybe I am ready to be worked on my neck. That's what I get out of this conversation. So that will be fun to go to him in a week and speak about it. Yeah, I'm confident that the things will get right. That's okay.
Right, and that's so interesting too, because if your provider's getting insecure, should I be treating your neck? What's that signal to your body? This is unsafe. I shouldn't do it. My symptom flare-up's probably going to last a whole lot longer every time I get treated because my provider is uncertain. So there's sort of these subtleties happening there that are really important to address, and just openly communicate. Hey, if you're feeling, unsure about treating my neck, then I feel unsure about you treating my neck, and I think my symptoms flare more.
Yeah, thanks for that. And do I do the exercises, the eye exercises, with or without the prism glasses? I don't know if I missed that answer or.
It depends on which exercises they are. I would lean towards trying to do them without for most of them. But also I would focus on the neck first.
Yeah, that's step one.
Try to figure out, like, if you get good neck work, do you need the prisms at all? Does it completely resolve, right? And so, like,
Wow.
that's really the question.
Yeah, that would be really interesting.
Yeah.
Thanks for that.
Yeah, and you may need to find a different provider, right? If this provider's not comfortable, it says that they probably aren't super experienced with this. So you might just want to look to see if there's somebody else that might be a better fit. But I know it's hard to find this. This is one of the hardest things for us to even recommend, because everyone's hands are so different. The training in different countries is different. So it's extremely difficult.
Yeah, it would be nice if we could see all the videos. That would be very helpful.
Yeah.
So,
Yeah.
yeah, we'll see. Thanks for this. This is helpful.
You're welcome. Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.